I cannot say that the facts around loneliness, some of the research that was presented is surprising. You feel loneliness now, right, in this day and age. And maybe I am in a season where I have felt it, but the ability to be able to articulate and communicate that feeling is new. And so I'm glad that there are studies. I'm glad that this team is engaging in research to better understand how loneliness impacts, and not just for economic success, but for people to be whole.
I spend a lot of time with our constituents across the district, and I get a lot of people sharing with me their personal stories of struggle right now. And I think families are stressed. It's not just what I feel. Social studies have shown that parent stress levels are at an all-time high, coupled with the fact that we're experiencing an acute youth mental health crisis in this country, and we know that we're really reaching a breaking point for families at multiple levels. I think it is essential that we tackle some of those acute stressors, which is high cost of living, lack of access to affordable housing, lack of access to affordable and high quality childcare, and healthcare costs. Those are some of the top things that I've been working on in Congress through bipartisan solutions. And we're just beginning to sort of tip the scales on some of those things, and we gotta keep going.
There's a lot of struggles in today's parents are facing here in Michigan and across the country. Parenting is a difficult thing to do under the best of circumstances, if not the best of circumstances. A lot of my work really thinks about childcare, and that is a huge stressor for way too many families. It's really difficult to find childcare. If you find it, it's often of not incredibly high quality because the system has been neglected for decades. It's incredibly expensive. And then a lot of times parents can't even find an option, so they end up on wait lists. And all of this leads to an enormous amount of stress and scarcity during an already difficult time. And what we're talking about today can also lead to isolation. If you're not able to build social connections because they're not places where other parents are congregating, and where you're able to make connections with other parents going through the same things that you are. And that has cascading effects on children, both the direct effects of children. They need high quality early childhood experiences so they can develop healthily, and that can happen in households or it can happen in childcare programs. But either way, you need low stress environments, you need reliable relationships with caregivers, and all of that gets compromised when we have a childcare system that is built on scarcity. And again, a lot of that comes down to the fact that there's not enough public money in the system. Don't treat childcare at all the way that we treat something like public schools as an essential piece of social infrastructure. And so it leads, again, just sort of putting fuel on the fire of the already difficult parenting years.
I think the biggest takeaway for me is that the role that government plays, whether it is the local or the state or the federal, requires complex, intentional, and consistent assessment. What worked last week may not work next year. And your community may change, the individuals you're dealing with may change. There are other dynamics that impact your community, whether it's the state or federal level. All of that needs to be evaluated on a constant basis. And so good public policy at any level just requires good work. And in a partisan world that we live in, it requires bipartisan good work, which means everybody has to be committed to the end goal, which is what's the best policy for our community. I might look at it differently than my Democratic colleagues. They might look at it differently than I do, but they're simply Americans that have a different perspective. I still need to find a way of solving the problem for my community.
One of the themes of today's discussion was the amount of social isolation that families were experiencing in Michigan, and the amount of anxiety families, especially families with young children, are experiencing. And so when we're talking about public policy solutions, we need to both look at economic justice, but also ways that we can create and foster supportive environments to create positive social connections. So supporting child care institutions, not only because it's a critical part of our economic development strategy, but also that creates lifelong bonds between families and creates stronger connection within a community.
The stress is real for families, and just really finding spaces that families can feel connected, and creating those spaces in a nonprofit organization is how can we ensure that we're creating those spaces and create programming that focuses on families, especially parents who are feeling lonely, and giving them access to different programming.
I think we're seeing it come to bear with the levels of mental health challenges that our young adults and our students are struggling with. It is the reality, and it is the result of that isolation and loneliness in our communities. It is absolutely preventable. We can come back to creating community and being there for each other.
I think to support families better, we really need to be listening to what they need. And I think what we're hearing from families at the state level is a lot about childcare, a lot about investing in education, a lot about making sure that they have opportunities to learn and grow outside of school as well. And so trying to find ways that we can strengthen those systems that serve kids and families through childcare, through education, through additional mental health services or those extracurricular activities is really important, but also just finding ways to support families with sustainable opportunities for income, with good jobs that allow them to take the time after school to spend with their children. All of those things really have to come together to help families be as healthy as they possibly can and to create environments where kids can feel secure and can thrive.